Dr. Daniel Petrylak joins us here at ASCO 2014. Talk about prostate and primarily bladder cancer. Thanks for stopping by.
Thank you.
Let's touch on quickly some of the work that you presented here at this conference.
So we had several presentations. I'd like to talk first about some of the data in bladder cancer. So for advanced bladder cancer, the standard of care for a patient with metastatic disease is the combination of gemcitabine plus cisplatin. And that will result in complete tumor regression in about a third of patients, partial regression in about another third of patients, and another third of patients don't respond at all. And the problem, of course, is what do you do for those patients who've either failed gemcitabine and cisplatin or relapsed after treatment? And up until recently, we've had no leads as far as therapeutic agents are concerned. There's some data that was presented at this meeting looking at the anti-PD ligand antibody that has significant activity in metastatic bladder cancer. We had a 42% response rate, and there are patients who had complete responses of the tumor despite the fact that they've had 2 and 3 prior chemotherapeutic regimens. And I think this is one of the most exciting findings from the meeting, and certainly this is going to be followed up in a phase 2 trial that's going to be open at multiple centers across the United States.
What is the role of immune therapy in the treatment of advanced bladder cancer?
Well, we're now finding out with the anti-PD ligand that immune therapy does have a role. And whether this will be in second-line treatment or first-line treatment, I think that's something that's going to be determined over the next several years. But bladder cancer is an immune-responsive disease. We know that from the early form of bladder cancer, in other words, superficial bladder cancer, where a drug called BCG will cause an immune reaction and delay progression in those particular patients. So it does have a role now not only in the superficial patients but in the advanced patients.
When we leave ASCO, what future studies are planned that have your attention or that you're excited about?
I'm excited about this large phase 2 trial that's going to be done with the anti-PDL antibody in bladder cancer. We have it open at Yale, and it's going to be open at our what's called care centers, which is a network of hospitals that are in Connecticut that are a part of the Yale Smilo Cancer Center. So that I'm very excited about that. I think that we have a chance to really make a big difference in therapeutic outcome in this disease.
Very good. Thank you, Dr. Petrylak. Thanks for sharing, and hope you come back and share your future work with us.
Thank you. Appreciate it.
Okay.